palliative care is symptomatic or treat the complaints when they arise. I think somewhere we have to register that, and palliative care involves a lot of counseling. The psychosomatic issues are very, very significant. Patients are already in a zone of depression and end of life care. So we have to kind of reach that level as bring them to a point of acceptance. So I think cannot undermine counseling in any manner. Counseling also of the relatives. So sometimes when you're in this phase of palliative care, we come across the situation where the patient is not going to benefit with the treatment you're giving them, especially when you're talking of therapeutic treatment like chemotherapy, surgery, radiation. But the relatives are so at a loss to be an acceptance of the situation for their next of kin, where they would be very adamant, I want to leave no stone unturned, I would like to do this, please do this, please do this. So very often you then have to also work on the caregiver, that understand what we are doing is not going to benefit the patient. It is probably being done only because you want it done, or because you are probably have the facilities to be able to, the finances to be able to sustain it. Sometimes it's expensive treatment that has very poor outcome. So the caregivers need to be counseled on that. I am sometimes also open to the idea that you could be a little lenient, because eventually the caregiver is the one who's going to survive the patient. So the last thing you want to do is leave the caregiver living in guilt for the rest of their lives, that, I didn't do this for my next of kin. So sometimes we do play along, counseling them that, the outcome's compromised, but if it's going to make you any happier or comfortable, and it's not really, you're not really selling your house to support such a unindicated treatment, then we could probably help and go along, play along with you for a bit. So that is where I think caregivers counseling is important. And otherwise, I think palliative care should be strictly restricted to symptomatic treatment, and do not, I time and again repeat, be stingy in painkillers. The last thing you want is patients to suffer pain in their end of life phase. There is nothing like all those silly questions that come up. Will I get addicted to morphine, or is this right for me? Will I damage my kidneys? I mean, when you're on end of life zone, I want you to be comfortable.